We previously learned that the pancreas secretes two important hormones for the regulation of your blood sugar level called insulin and glucagon. While we rarely see any problems associated with glucagon, we do see problems associated with insulin production or the body's sensitivity to this hormone. And in this lesson, you will learn what happens when your pancreas does not produce enough insulin or your body cells stop responding to the insulin in your system. When you eat a meal, the food travels through your digestive tract where it is broken down. The starches and carbohydrates that you eat are broken down into simple sugars. And these sugars get absorbed out of your digestive tract and enter your blood as blood glucose, which is also referred to as blood sugar. The bloodstream carries the glucose to the trillions of cells in your body that rely on it for energy. However, a glucose molecule cannot simply travel up to a body cell and enter. It must be let into the cell with the help of insulin. It is as if insulin has a secret knock that opens up the cell and lets glucose come in. Without insulin, glucose cannot leave the blood and travel into your cells. In a healthy individual, sufficient amounts of insulin are produced by the pancreas to respond to the amount of sugar in the blood. Also in a healthy body, the cells are able to take in enough glucose to maintain a normal range of blood sugar, which before a meal is typically between 70 to 130 milligrams per deciliter. However, if there is a problem with insulin, blood levels of glucose can rise dramatically. If this is the case, glucose will be lost through the urine because the kidneys cannot reabsorb it fast enough. Now you might think that excreting glucose through the urine is a good way for the body to get rid of excess glucose. However, the problem is that water follows glucose out of the body, which can lead to dehydration. Now, as you might guess, this loss of water also leads to an increased frequency of urination and an increased thirst. These are the classic symptoms we see in a group of metabolic disorders called diabetes mellitus. Diabetes mellitus is defined as a condition in which the pancreas does not produce enough insulin or cells do not respond to insulin that is produced, resulting in high blood sugar. Now, it's interesting to note that the word diabetes is Greek for siphon, and that the prefix mel from the word mellitus means honey, which of course is sweet. Because we just learned that a person with this condition will lose sugar through the urine, we can see that the word diabetes mellitus literally means something sweet is siphoned or passed through the body. Analysis of the urine is one way to check for diabetes. Now we know that your body cells cannot get glucose without insulin, so you might be wondering how your cells get energy. After all, glucose is the main form of energy for your cells. In a person with diabetes, fats and sometimes proteins are broken down for energy. This helps meet the energy needs for your body, but because the body still craves the quick energy of carbohydrates, a person with diabetes may experience increase in hunger. So we see that a person with diabetes mellitus presents with some classic symptoms: polyuria,